Yeah, this is a really important question. Like I said, a lot of patients relapse who've been exposed to BCMA CAR T cells, and there are multiple mechanisms for how they relapse, but one that has really emerged through multiple reports is that they actually just lose expression of the antigen of BCMA. And there are multiple ways that can happen, but mostly through mutation of the BCMA locus. And so you can get mutation or deletion of the locus itself, and that basically leads to loss of expression. And without the antigen, there's nothing for the CARs to recognize, and so the multiple myeloma can grow. So what we need is other targets, basically, for those patients. Because other BCMA drugs are probably not going to work in that scenario, and so there are other targets that are being developed. So, for instance, there are CAR T cells that are being developed against GPRC5D, and those have shown really promising efficacy, even in patients who relapsed after a BCMA CAR. And there's also a bispecific that was just approved targeting GPRC5D, so talquetamab. So that's very exciting to have that available now. And then there are other antigens that are being targeted. So there's a bispecific antibody that targets FcRH5 called cevostamab. And so I think developing new targets, and potentially by combining those different treatments that target different antigens on the cell surface of myeloma cells, we may be able to avoid that antigen escape and sort of keep patients in remission for much, much longer.